Hello, my name is Claire Brindis, and I'm a distinguished professor of pediatrics and health policy and emeritus director of the Philip R. Lee Institute for Health Policy Studies at the University of California, San Francisco. I am so delighted to welcome all of you to this very important workshop on advancing maternal health equity and reducing maternal mortality, topics that are very dear to my own heart and my own scholarship. I'm a member of the National Academy of Medicine and a member of the committee that planned this workshop. And I am really thrilled at this moment to be able to introduce to you Dr. Victor Shao, President of the National Academy of Medicine, who is a dear colleague and who is a visionary and so committed to this topic. And he will be setting the stage for us by opening up this workshop. Victor?
Thank you, Claire. Thank you so much. And welcome everyone to this very important workshop. I'd like to begin thanking the planning committee members, Claire Brindis from UCSF, Elena Fuentes-Affleck, also from UCSF, Brenzin Tucker-Edmonds from Indiana University, and Melissa Simon from Northwestern. The sponsor workshop are March of Dimes, Merck, for Mothers, Ronald McDonald House Charities Global, and of course, we are very happy National Academy of Medicine to sponsor as well. I want to thank the staff, and particularly Rose Marie Martinez, but also Kerry McHugh, Kat Anderson, and Christy Park. You know, I was just thinking, as chatting with Claire, the origin of this workshop came from a discussion at the National Academy of Medicine Council over 2 years ago, where the council members expressed great concern for and intense interest in addressing this important issue. With Rose's leadership and initial assistance from Morgan Kenrick, my chief of staff, we began planning this workshop and lining up some of the sponsors. But I do want to give the majority credit, or all the credit, to Rose and her team, who's taken right across the goal line. She's passionate about this topic, and I'm so grateful to her for putting this workshop together. Let's talk about why we're here. The US faced alarmingly high rates of maternal morbidity and mortality, a trend that distinguished, unfortunately, us from other high-income countries, which has seen decreases in maternal mortality in the recent years. We ranked near the bottom of the OECD countries. In 2014, we ranked 30 out of 31 countries, ahead of only Mexico and more than 3 times higher than Canada and United Kingdom. Not very proud of this. Of concern is the fact that there are large racial, ethnic, socioeconomic, and geographic disparities in maternal mortality and morbidity rates within the US. In particular, Black indigenous communities face disproportionately high risks. For example, pregnancy-related mortality ratio among Black communities is more than double that of white communities, irrespective of education level. Furthermore, there are disparities in rates of premature and low birth weight infants, especially among the communities of color. You know, these numbers show little signs of improving, and recent evidence indicate that Black, Hispanic, indigenous birthing people are being disproportionately affected by COVID-19 during pregnancy. Well, we all know there are numerous factors that contribute to these disparities. Barriers to accessing care, a growing prevalence of chronic conditions, maternal stress, inadequate training of healthcare workers, providers, and bias and systemic racism that perpetuate inequities in the healthcare system. And of course, social determinants of health, such as employment, housing, and transportation. I'm sure you all agree with me that in the 21st century, these trends are totally unacceptable. Because maternal mortality is considered a core measure of social health, it has deep, lasting effects on infant and child health. It's essential to understand the determinants of maternal mortality and develop effective prevention and intervention strategies. Well, kind of good news, recent actions to prioritize maternal health at the federal level step in the right direction. In April 2021, the White House issued its first ever presidential proclamation marking Black Maternal Health Week as part of an effort to highlight racial gaps in pregnancy and childbirth-related deaths. Additionally, the White House fiscal 2022 budget request asks for substantial funding, some $200 million, to expand maternal health and decrease implicit bias and fund maternal mortality review committees, which review local death data up to 1 year postpartum to help CDC to make recommendations. So these are steps in the right direction. I think we should all be encouraged by this. And I certainly give credit to this new administration for taking this on and understand how important it is. But you know, improving maternal health requires long-term focused strategy, all of society's commitment. There's a need to examine the current rate of maternal death in the United States, explore the factors needed to enable communities and healthcare systems to be more effective, reducing maternal mortality and morbidity, and improving outcomes for pregnant people through the fourth trimester. That's what the workshop prospectus describes this whole activity. So I know you'll be actively discussing the issue for the next 2 days, and I'm very excited about this, and I wish you a successful meeting, and I really hope that we're going to move the needle on this issue. So thank you very much, and back to you, Claire.
Thank you so much, Victor, for your support and for setting the stage for all of us. I first want to express my tremendous gratitude to the many remarkable and accomplished individuals you'll be hearing about and from throughout the next 2 days. Their expertise, their wisdom, their scholarship, their passion and advocacy are going to be and are some of the most important tools that we have available to move that needle. They really were so generous in their time, and they are generous sharing these insights and this wisdom. And we're so grateful for your time and effort. They're very, very busy people, and we always ask the busiest people to help us. You will find a speaker's bio sketch in a file listed at the bottom of the meeting page that you're watching from. I wish we had time to share in our introductions of each person so many of the many accomplishments that they bring to this table, and not only their accomplishments, but also their deep humanity, which we really need in order to advance this agenda of advancing. Sorry, hopefully not too many more of these challenges, but let me just share that we'll start promptly at 11 o'clock East Coast time. We will hold a 2 one-hour session until 1 o'clock, then have an hour break for you. And then we'll return promptly at 2 o'clock for 3 afternoon sessions and end the day at 5:30. Please note that you have the ability to submit questions throughout the time that we're together. Please enter your name and affiliation, and we'll try to share as many of your questions as possible in the few minutes that we have for the Q&A.